Chaco Suzuki with RealSelf TV, and we are down in sunny Southern California with America's top dermatologists, including Dr. Matt Mahlberg. Hello.
Hi, how are you today?
Good, how are you?
Good, thank you.
Could you share with us your specialty and where you practice?
Sure, I'm a dermatologist and dermatologic surgeon in Northern Colorado.
We are going to go over Vbeam 101 with you. Can you tell me what is it?
Sure, a Vbeam is a pulse dye laser. A pulse dye laser is a laser that's designed to treat blood vessels. So blood vessels often will occur on the face, the legs sometimes, the neck, hands, and this is a very targeted blood vessel laser that helps to eliminate those blood vessels, but leaves the rest of the skin unharmed.
And what happens when you go in to get Vbeam? What is it like? What does the machine look like? A lot of RealSelfers, they like to know before they go into the doctor's office what to expect.
Absolutely. So the laser is a device that's in the office. It's a no anesthesia procedure. So you walk in, it takes about 5 to 10 minutes to treat, and you walk right out. Depending on the settings that we choose for the laser, there can be a little bit of downtime, meaning some bruising or redness, or no downtime, minus a little bit of redness and a little bit of swelling. So it's a quick treatment that usually people can do at the end of the day, and by the next morning look very normal, or even walk out if they don't mind a little bit of swelling and still look like themselves.
And do you see results that quick, as fast as the next day?
So it depends on the treatment that you're utilizing and what you're using it for, but the most common thing that we use it for is something called rosacea. And rosacea is a rash, sometimes it occurs on the face, but it also comes in a form where people will develop excessive blood vessels. And certain people of different ancestries will develop that. Irish people or Scottish people will more generally develop that on the face. So they get redness and blood vessels across the face. In that circumstance, we can see improvement with one treatment, but sometimes it can take 3 to 5 treatments to really get it all cleared up.
And when we think about lasers in the face, I think a lot of people get scared about what if it's going to hurt. So can you talk a little bit about that? I know the treatment's pretty short, so that's good, but pain management and expectations.
Sure. So the treatment is a no anesthesia procedure. So we generally have patients come in, there's no injections, there's no topical anesthesia necessarily needed. And what's done is there's a little puff of a laser. It feels like a quick puff of air. Some people will equate it to a slightly not so painful snap of a rubber band, but it's not very painful. I mean, it's just like a bunch of little puffs of quick air on your face, and you're fine. So most patients, we do a warning sort of test shot, and we just zap them with one laser. They get used to it, and then we just proceed from there. So it's a very comfortable and very manageable treatment.
And is there anything for aftercare after the treatment they need to know? Ice or special serums, lotions, oils, anything for after the procedure?
The main thing we want to do is make sure people are being very good with sun protection. And I'm a dermatologist, so I say that to everyone.
Yes,
but particularly important after laser, because sometimes people, if they're treated too aggressively or with aggressive settings and they go out and have a lot of sun, they can get some darkening of the skin. So we're very careful with sun exposure after the treatment. And then if they have a bit of bruising, which can sometimes happen with our more aggressive settings, they can cover that up with some makeup immediately afterwards. So ice is usually helpful just to minimize swelling, particularly if we're treating blood vessels around the eyes. But it's really well tolerated, and there's really not much aftercare at all. So there is one other indication we'll sometimes use it for, which is called hemangiomas or port wine stains. And these are the birthmarks that people will have.
Yes.
That are big red patches or even blood vessel growths that children can have. Those we typically have to use higher settings and stronger settings, and sometimes they'll have some bruising afterwards. So in those circumstances, we'll have a little bit more downtime.
And it does seem like for port wine stains, children get treated. Is Vbeam safe for all ages?
It is. It's most effective in children to treat port wine stains, but even adults, it can be very effective. Sometimes it requires more treatments to do that, though.
Hey, great. Thank you so much, Dr. Mahlberg. So much great information. If you'd like to learn more about him, check him out on his profile on RealSelf.com. Thanks again.
Thank you so much.